question. Right. So if you have read and understood, considering it clinical examination station, please begin.
Yes, I will enter the room. I will wash my hands. I will introduce myself. Hello, I'm Dr. Faizan. I'm one of the surgical doctors. May I confirm your name, please?
Yes, I'm Tom, 72 years old.
Nice to meet you, Mr. Tom. Today I've been asked to examine the blood vessels, the blood supply to your lower limbs. This will involve me looking, feeling the pulses, and doing some special tests. Is that okay with you?
Yes.
Can we proceed further? Do you want anything for your pain?
No, that's all right.
Painkillers? Okay, that's nice. Oh, I will expose the patient. I will ask the patient to expose himself from his lower abdomen till the feet. He can keep his shorts on. I will start by general inspection. I will make the
Would be the
patient lie down,
position of, yes,
lying down on the couch.
yes.
I will start general inspection by looking at the surroundings. Is there any working aid, any drug charts, any uh, medicines, etc. Then I will inspect the hands of the patient. I will look for any nicotine staining, uh, any xanthomata dorsally. I will look for any nail fold infarct, splinter hemorrhages, any gangrene or necrosis, cyanosis. Then I will also look for any hair loss and shininess of the skin. Then I will examine the legs. I will do an inspection of the legs. I will look for the color of the legs. I will look for the any cyanosis, any gangrene, any ulcers. I will inspect between the toes and over the heel also, and I will look for any signs of venous diseases. And I will also look for any muscle wasting. I will ask the patient to move the toes, wiggle the toes to just assess the gross motor function. Then I will go for palpation. I will compare the temperature with the back of my hand, starting from the thigh downwards, and look for any decrease in temperature. I will check the capillary refill time. Then I will feel the pulses of the lower limbs. I will feel the femoral pulse at the midinguinal point, popliteal pulse by flexing the knee and behind the knee, and posterior tibial pulse behind the medial malleolus and dorsalis pedis artery lateral to the extensor hallucis longus. Then I will also do the Burgess test. I will elevate the patient's legs to for 45 degrees angle for 2 minutes, and then I will see for any ask the patient whether he has any pain. Then I will make the patient sit on the edge of the bed and look for any change in the color of the leg, such as dusky blue or purple. Then after that, I will also auscultate for any bruise and the femoral artery at the medial aspect of thigh, for iliac artery at the inguinal point, and I will also auscultate for any aortic bruit or renal artery bruit. Then I will also measure the ankle brachial pressure index if time permits.
Feel
That will complete my exam.
No, feel the abdomen for any evidence of aortic aneurysm and auscultate for the renal and aortic breeze.
Okay.
Then, if time allows, how
Uh,
would you complete your examination?
If time allows, I would check the BP and ankle brachial pressure index,
Yes,
and I will do a complete neurological examination of the both lower limbs, and
Yes.
also a complete cardiovascular examination, and also a vascular examination for the upper limbs.
Okay, good. We still have 1 minute left. So if you can tell me, once you're examining, how would you suggest, how would you know that what type of color change is there, which is suggesting normal ischemia or severe ischemia? And how would you know if the ulcers, or if you can describe the ulcers that you look for, how would you know if it's arterial or venous?
Yes, venous ulcers are usually seen in the gaiters area, usually over the medial malleolus, and they have sloping edges, whereas arterial ulcers are usually seen at the pressure points, such as the head of the metatarsal, first and fifth metatarsal, and the tip of the toes,
Yes.
and yes, and
So for
neuro.
ulcer, you look for location, shape, depth, and size and color of the ulcer, or yes.
Yes, location, size, shape, and depth. Yes.
Yes. Okay, 3 seconds left. Can you please summarize your examination?
Yes, I've examined a 72-year-old male patient with complaints of progressive bilateral pain in the legs. On examination, the patient had uh, signs of nicotine staining in the hands, and on inspection of the lower limbs, the skin was shiny. There was loss of hair, and uh, on the palpation, I was not able to palpate the dorsalis pedis and the posterior tibial artery on the both the sides, and also the Burgess test was positive.
Yes.
Uh,
So what
and
are your provisional and differential diagnosis for this patient?
yes, my provisional diagnosis is atherosclerotic or lower limb vascular disease.
Yes, or diabetic peripheral vascular disease.
Or
How would you
diabetes.
plan to manage this patient? What
Yes, ma'am.
investigations would you carry out, and what is the treatment that you can suggest?
I will do blood tests including blood sugar levels, cholesterol levels, and the fasting lipid profile, glycated hemoglobin, full blood count, and I will do imaging such as arterial duplex scan and a
Yes.
CT or MR angiography.
Yes.
Then management, I will ask the patient to, I will control the blood sugar levels, and uh, uh, for anti-cholesterol, I will start the patient on cholesterol lowering agents, uh, and or control the hypertension as well. And I will
How would
for
you
the
determine what management patient needs?
yes, it depends on the ankle brachial pressure index and the uh, severity of the condition.
Yes, if you are asked to manage the patient conservatively, what does that mean?
Conservatively will be avoidance of smoking and
Yes,
control
management of, yes,
diabetes, hypertension, and hypercholesterolemia.
cholesterolemia, very good. And maybe consider antiplatelet agents.
Yes, okay.
All right.
Antibiotics.
What surgical or invasive management can be offered to this patient? What are the options that you
surgical
have?
Yes, ma'am. We have endovascular stenting or surgical bypass,
Very
or
good.
in case of gangrene, the patient might need amputation.
How would you determine if the patient has a critical limb ischemia?
Yes, critical limb ischemia is when the ankle brachial pressure index is less than 0.4 and there is a severe rest pain, and or if there is already gangrene of the uh, toes, or gangrene of the foot or toes. This
Yes, at rest.
can
It's important to say when the ABPI is less than 0.4 at rest or pain at rest.
Okay.
Yes, pain, especially
Okay.
pain at rest. Then it is critical. Then it should be good. Right. Okay, good. Thank you.
Thank you, ma'am.